The NeuDisc has not been approved by the Food and Drug Administration and is an experimental device not available for sale. The NeuDisc is currently undergoing preclinical testing. Replication Medical, replicating the disc nucleus for the treatment of degenerative disc disease. Low back pain afflicts at least 6 million Americans annually. Back pain is often associated with degenerative changes in the spinal disc, which take place over time. With aging, the jelly-like material in the nucleus of the disc loses its ability to take up fluid and produce pressure in the disc. Without pressure, the nucleus will not cushion the spine, and elements of the spine can be compressed, leading to pain. This condition is known as degenerative disc disease. This investigational product, known as the NeuDisc, would replace a degenerated nucleus with a material intended to mimic the behavior of native healthy nucleus, with hydrogel material that swells in the presence of fluid and repressurizes the disc. A polymer mesh in the NeuDisc structure is designed to limit movement and help ensure that the NeuDisc does not penetrate through the annulus. Proper position of the NeuDisc can be visualized radiographically due to the platinum-iridium wires that are embedded in the device. At the beginning of a NeuDisc implant procedure, a discectomy is performed to remove the unhealthy nucleus pulposus and create a space for the NeuDisc to reside. A special set of orthopedic instruments have been designed to make implanting the NeuDisc easier and more streamlined. First, the working tube is inserted in its open position. As the working tube is closed, the tips of the working tube separate, causing the disc space to distract. The working tube is held in the closed position by sliding the frame connector over the closed tube. For convenience, the frame adapter can be used to attach the working tube to a standard surgical frame or arm. In preparation for inserting the NeuDisc into the intervertebral disc space, the NeuDisc is slid into the tip of the inserter instrument, with the NeuDisc's polymer mesh layers aligned with the instrument's laser-marked lines. The inserter is then placed into the working tube until fully seated. The inserter screw is slowly turned clockwise to drive the NeuDisc into the disc space. Radiographic imaging is used to ensure that the NeuDisc is positioned at the midline of the disc. The direction of rotation may be reversed to assure proper positioning of the NeuDisc. Once the NeuDisc is in the desired location, it is released from the inserter and all instruments are removed. Radiographic imaging of the wires within the NeuDisc is used to ensure that the implant is positioned properly at the midline of the disc. The disc space containing the NeuDisc is irrigated with normal saline to allow the implant to begin swelling. The NeuDisc continues to slowly absorb body fluids and swell until it conforms to the surrounding anatomy. The NeuDisc is intended to completely fill the denucleated space and apply a lifting force to the vertebral end plates. Since the NeuDisc is designed to be comfortable and flexible, it should bend, rotate, and move with the spine, which would allow for full movement without subjecting the end plates to high stress. And like a healthy nucleus, the NeuDisc is expected to respond to the diurnal pressure cycle in the spine by respiring, slowly expelling and absorbing fluid in response to load changes, circulating fresh fluid through the intervertebral space. Replication Medical, replicating the disc nucleus for treatment of degenerative disc disease.